Anatomy and physiology of larynx. So let's start with clinical anatomy and physiology of larynx. Larynx is a portion of the respiratory tract containing the vocal cord. It is 2 inches in length, approximately 2 inches in breadth. It's a tube-shaped organ and opens into the laryngeal part of the pharynx above, and it is continuous with the trachea below. The function of larynx mainly is protection of the respiratory passage, but also helps in deglutition, that is swallowing, respiration, that is breathing, phonation, that is voice production. The skeleton of the larynx is mainly made up of cartilages. They are mainly hyaline cartilage. These cartilages, when present in the midline, they are unpaired cartilages. They are the thyroid, cricoid and epiglottis. Whereas when they are present on either side, they are called the paired cartilages. They are Arytenoid, corniculate and cuneiform. Let's study about these cartilages in detail. Starting with thyroid cartilage. Thyroid cartilage has 2 laminas. So let's see what is the 2 laminas of the thyroid cartilage. These are the 2 lamina, right and left lamina. They meet in the midline to form a prominent angle called as laryngeal prominence or the Adam's apple, also called the thyroid angle. These angles are almost same for both the individuals, male and female, up to the age of puberty, whereas at the time of puberty, under the influence of sex hormones, it will become more acute, resulting in harshness of voice in male, and becomes obtuse, resulting in the softness of the voice in females. There is a notch in the upper border of this, it's called the superior thyroid notch. There are 2 notches on the inferior border of this, it's called the inferior thyroid notch. 2 projections are there, superior cornu, and 2 downward projection called the inferior cornu. This is the same thyroid cartilage, the lateral profile. So cornu is a horn-like projection. Moving on to the cricoid cartilage. Cricoid cartilage is a cartilage which is like a ring-like cartilage. It has got a narrowed anterior arch and a broad portion which is called the posterior lamina. This is the lateral profile of the same cricoid cartilage. This cricoid cartilage has got a facet, you can see that here, which articulates with or unites with inferior cornu of thyroid cartilage. Also on the lamina of the cricoid cartilage, the arytenoid cartilage is going to sit over this. So what is this arytenoid? We will see later. Pyramidal like cartilage, it will sit on this lamina. Okay. Moving on to the epiglottis. Epiglottis is an elastic cartilage, is a leaf-like cartilage. The root of the leaf is attached to the inner surface of the thyroid angle. This is a thyroid angle, inner surface of thyroid angle. This leaf is coming and getting attached. You can see that here. Then this epiglottis has got 2 lateral borders and 1 free margin and 1 root. It has got an anterior surface facing the tongue and the posterior surface faces the larynx. So upper free edge is free to move. It is this edge which our school teacher keeps telling that it falls backward to close the laryngeal inlet during the act of swallowing. The lateral margins are attached to the arytenoid cartilage by aryepiglottic fold. Moving on to the next cartilage, the arytenoid cartilage. These are the small pyramidal shaped cartilage. They are sitting on the broad lamina of the cricoid cartilage. That is situated on the posterior aspect. It has got an apex, base, medial surface facing one another, anterolateral surface facing forward and laterally, and a posterior surface. Apex is attached to the lateral border of epiglottis by aryepiglottic fold, whereas base is sitting on the lamina of cricoid cartilage. Over the apex, we can also make out 2 tiny cartilages, that is corniculate and cuneiform. It has got 2 projections near closer to the base. One forward projection is called the vocal process and one sideward projection is called as a muscular process. As the name suggests, vocal process, vocal cord will be attached to this. Muscular process, muscles of the larynx are attached to this, which help in movement of this arytenoid. In turn moves the vocal cord and thereby causing difference in the tone of the voice. So muscular process gives attachment to the muscles. Vocal process gives attachment to the vocal ligament or the vocal cords. Moving on to the other 2 tiny cartilages, corniculate and cuneiform. As I already told you, these are the tiny cartilages present within the aryepiglottic fold. Corniculate is cone shape or small rod shape is cuneiform or wedge shape. It will give a further strength to the or support towards the aryepiglottic fold. That is a function of corniculate and cuneiform. So that during the act of deglutition, when the aryepiglottic fold closes, it will have some strength or stamina to stabilize the two aryepiglottic folds towards one another, thereby preventing the food from entering into the laryngeal cavity. Moving into the laryngeal cavity, it extends from the laryngeal inlet to the lower border of cricoid cartilage. The narrow region in the upper portion is called vestibular fold, and the narrowest region in the lower portion is called the vocal fold. The space between the two vestibular fold is called as rima vestibuli. The space between the two vocal fold is called as rima glottidis. So glottis refers to vocal folds. So you can see this. There is one membrane here. It's called the quadrangular membrane, and this is the cricovocal membrane. The upper portion of this will get thickened to form the vocal fold. The lower portion of the quadrangular membrane gets thickened to form the vestibular fold. So the space between the vestibular fold is called as rima vestibuli. The space between the vocal fold is called as rima glottidis. Whereas this dilatation which is present in between the rima vestibuli and rima glottis is called the ventricle or the sinus of the larynx, through which the mucus produced by this will lubricate the vocal folds, because vocal cord is lined by stratified squamous epithelium. Whereas rest of the respiratory passage is lined by ciliated columnar epithelium with goblet cell. Goblet cell produces mucus which traps the dust. Cilia will move the mucus towards the throat so that we cough out, or gag reflex will be there to clear the throat. So because of this hourglass appearance of the laryngeal cavity, it can be divided, the whole laryngeal cavity can be divided into three portions. The glottic portion, that is where the narrowest portion where the two vocal cords are there, that is called the glottic portion. Above that is called a supraglottic, and below that is called as infraglottic. So this glottic portion is the narrowest portion of the interior of the larynx. It's guarded by two vocal folds, and there is a diverticulum above that which is called as a ventricle. So already I told mucus is present over there. This funnel like portion is called as supraglottic portion. It is above the vestibular folds. It is also called the vestibule of the larynx. Below the vocal cords or below the vocal folds, this inverted funnel-like structure is called as the infraglottic portion of the larynx. Moving on to the blood supply of the larynx, the blood supply can be understood better in this diagram. One blood vessel will come from above, it is called superior laryngeal artery. One blood vessel will come from below, it is called inferior laryngeal artery. These superior and inferior laryngeal arteries are branches of thyroid arteries. Which thyroid? Superior and inferior thyroid artery. Since the thyroid gland is present in front of the trachea, the blood vessel going to supply the endocrine gland called the thyroid gland will also supply the larynx by giving superior laryngeal, and from below it's an inferior laryngeal artery. Veins will have similar name, that is superior laryngeal vein and inferior laryngeal vein. Finally they end up in internal jugular vein, whereas these arteries are branches of external carotid artery. Lymphatic drains, these lymph vessels drain into deep cervical group of lymph nodes that is present along the internal jugular vein. Deep cervical group of lymph nodes, deep in the neck. Cervical means neck. In fact, some of the lymph nodes present in front of the larynx will be called as prelaryngeal, and by the side of the larynx will be called as, which it can be called as paralaryngeal lymph nodes. Those are the other lymph nodes in which the lymphatics of the larynx can go. So this is about the clinical anatomy of the larynx. Moving on to the physiological aspect or the functional aspect of the larynx. The principal function of the larynx, most of them think that it is phonation or production of voice, but actually the main function of the larynx is for protection of the lower airways. How does it protect the lower airway? See, whenever there is during the act of swallowing, the entire larynx will move upwards towards the epiglottis, and epiglottis slightly falls backward to close the laryngeal inlet, thereby protection of the lower airways, so that we don't aspirate the food which we swallow, neither we take the food which is there in stomach back to the esophagus and to the larynx. Thereby, this is achieved mainly by elevation of the larynx towards the tongue and falling backwards of the epiglottis, closing the laryngeal inlet and thereby protecting the lower airways. So it acts as a lid which covers the laryngeal inlet on the glottic, protects the glottis. It helps in reflex coughing mechanism. If at all we have some irritant near the larynx, we try to remove it by means of coughing. Also, it helps in sudden closure so that foreign body doesn't enter our larynx. All this comes under one heading called as protection of the lower airways. The next major function of the larynx is voice production. The vibration of the vocal cord or the vocal fold produces voice. Actually, we have inhaled the air within the lungs are now gushed through the larynx. There are vibrations which are set. These vibrations will move across the narrowed vocal cords. These vocal cords can be tense, resulting in a high-pitched voice, or it can be relaxed, resulting in a whispering voice. This vocal cord can be abducted, resulting in deep breathing, and if it is adducted, then there is a phonation. So, helps in phonation or speech production is other important function of the larynx. Next function of larynx is the respiratory function of the larynx. Since the vocal cord controls abduction and adduction movement, controls the air which can enter the lungs and come out of the lungs. So thereby larynx act as a gateway or the air channel by controlling the width of the glottis. By regulating the gases exchange, that is carbon dioxide and oxygen which we take in can be exchanged for carbon dioxide which is there in the blood. So thereby providing the respiratory function of the larynx. I am not telling that larynx helps in exchange of gases, but it facilitates that if you are running a marathon, more amount of air will be drawn into your lungs, right? So thereby causing more exchange of gases in your alveoli of the lung. So when you are sleeping, less amount of oxygen will enter your lung, you will be snoring like this and all, right? So that is what I am telling, respiratory function by acting like a gateway. The other function includes circulatory function. How does larynx helps in circulatory function? By causing the air enter the lung, it can cause positive pressure. When the air goes outside the lung through the larynx, it can cause negative pressure. So by causing a positive and negative pressure within the thorax, it can alter the intrathoracic pressure, thereby regulating the blood circulation. So whenever the air enters the lung, there is expansion, right? So there is expansion of the lung, thereby helping in circulation. Whereas when the air goes out of the lung, there is a negative pressure created within the lung, so thereby helping in a venous return. So this is how it helps in larynx, indirectly helps in circulatory function. Last but not the least, chest fixation, or you can call it as abdominal fixation. By taking a deep breath, if you close your glottis, we can fix our chest, thereby we can alter our abdominal pressure, that is a positive intra-abdominal pressure, resulting in emptying of hollow organs. Like if we empty the GAT, it's called the defecation. If we empty the uterus, it's called the labor. If we empty the urinary bladder, it's called the micturition. It's called the micturition. So it helps in climbing, lifting heavy weights, all this by holding the breath. So what helps in holding the breath? Actually the vocal cords which are adducted. So thereby maintaining the pressure within the thorax and keeping the diaphragm pushed downwards, and thereby helping in fixation of the chest and emptying these hollow organs, especially the GAT causing defecation, urinary bladder causing micturition, and uterus causing labor or the childbirth. So these are the functions of the larynx. Thank you one and all for watching and learning from Logic Medico. Kindly subscribe to our channel and press the like button if you have gained value from this video. Thank you.